I'm Dr. Eppley, plastic surgeon of Indianapolis, and I would like to share a few thoughts with you about rhinoplastic surgery. I want to give you some thoughts and considerations to make before you go in and have a formal consultation with your plastic surgeon. First and foremost, rhinoplasty surgery can make some dramatic changes in the appearance of the face and in improving one's facial balance. It is obviously a very delicate surgery on a relatively small structure that has a lot of intricate components to it consisting of bone and cartilage. Because it is a very prominent portion of your face, understanding what rhinoplasty surgery can do or cannot do is extremely important to determine whether you will get a satisfactory outcome that will make you happy. Therefore, the use of computer imaging is a very important component of rhinoplasty surgery. After you have your consultation with your plastic surgeon, in which you've discussed your concerns and your desires, and your plastic surgeon has presented what he or she is capable of doing with the procedure, it is then very important to sit down on the computer and go over some imaging changes. The purpose of computerized imaging is not to guarantee what the result will be, but to really develop a communication and a dialogue between you and your plastic surgeon as to what the realistic outcomes of that procedure can be. That is extremely important to understand. What you may think is possible and what your plastic surgeon may think is possible may not necessarily be the same, and that's an important issue to certainly go over. So I always have every rhinoplastic surgery patient go through a digital imaging process. Also, the digital imaging process can also point out some adjunctive procedures that may be of benefit to your rhinoplasty, such as a chin implant, for example. So this is a very important step that you should have in your rhinoplasty consultation. Secondly, rhinoplasty surgery can be done through either what we call a closed or an open approach. A closed approach has been done for a long time and is a very fine approach to rhinoplasty. This is where all of the incisions are made inside the nose and work is done through that approach. While this can be a very fine procedure, in certain very difficult noses or even in secondary or tertiary rhinoplasty procedures, it can be very difficult to get predictable outcomes through this more limited visual approach. The revision rates are often a little higher with the closed approach. The more popular approach today is that of open. This is where you make the same inside incisions in the nose, but then you combine those with a little incision across the skin between the nostrils known as the columella. The skin can then be lifted up off of the nose, and one can really see in full view all of the structures of the nose, from the bone at the top of the nose down to the cartilages at the tip. It should be no surprise that having such direct access and good visualization oftentimes produces better results, with a decreased chance of having to have revisional surgery later for something that didn't turn out quite as everyone would like. This is a good point to have a discussion with your plastic surgeon. Many plastic surgeons have their own preferences, but you certainly need to know the advantages and disadvantages of open versus closed rhinoplasty surgery. Thirdly and last, many times rhinoplasty surgery patients are not only changing the external appearance of their nose, but are also improving the breathing inside the nose through manipulations of the septum and the turbinate bones. When this is done, we call this procedure a full septorhinoplasty procedure. It would be very common to change appearance as well as try to improve breathing during the same rhinoplasty surgery. The concept to grasp about that is that the breathing portions of your rhinoplasty surgery are often covered by insurance. What I have found, unfortunately, is that many patients believe that because insurance is covering the breathing portions of the surgery, that because we are there and we are going to do the cosmetic portions only, that insurance is going to cover that as well. That is a very erroneous concept and is really what I would call insurance fraud. Expecting or anticipating that insurance is going to cover the external or the cosmetic portions of the nose as well is simply not what your insurance policy was set up to do, and they usually make it quite clear that any external or cosmetic procedures of the nose are going to be excluded. It is therefore very important from an economic standpoint that you have a very thorough discussion with your plastic surgeon about what insurance is going to cover, what he or she is going to bill, and what responsibility you have prior to surgery, so you do not find yourself in an adverse financial situation after the procedure. Rhinoplasty surgery can be very exciting and offer some dramatic changes to the nose with great improvement, but I think as you walk into your consult, if you take these three concepts in advance, it will help you have a more educated and well-informed consultation with your plastic surgeon. I'm Dr. Eppley of Indianapolis, and I wish you the very best on your rhinoplasty surgery.